My name is Mary Semplaski. I'm one of the Fertility and Sterility Interactive Associates, and I have the honor and pleasure to be sitting with Dr. Ioannidis from Stanford. He gave a wonderful plenary this year at the ASRM about clinical research. Is it reproducible and applicable?
So I shared some thoughts and some evidence about what are some challenges in making sure that the clinical research that we do, that we analyze, that we publish, that we read in journals, and that we see disseminated is reproducible and useful, that it does translate to improving outcomes, that it does help patients get meaningful benefits out of it.
And what do you think are some of the barriers to this happening at present?
And in the current environment where we have far more researchers trying to do research and a flurry of data, much of which is not very trustworthy and of high quality, and probably lots of suboptimal analysis and lots of suboptimal publication practices, we see a plethora of results that are either false positives or exaggerated, or even when they're true, they are not useful eventually. So we need to think about how we train people to adhere to better, more robust research practices.
And it's a good reminder to sort of focus on the quality and not the quantity. What advice would you give to sort of rising researchers?
I think that we need to have a rounded approach to what we want to reward and what researchers should aim for, both young and old. Currently, as you say, we're rewarding mostly productivity, but we need to pay more attention to quality, we need to pay attention to sharing culture, we need to pay attention to reproducibility, do these results get reproduced, and finally also reward people for translational impact. So we need to instill a sense of excellence to young investigators to excel on all these dimensions rather than just publishing papers.